Let's go to Matters Health now, and you are aware of the long-standing dispute between health workers and the government regarding the issue of devolvement of health facilities and health services to the counties. Now, recently, the President directed the Health Cabinet Secretary James Macharia to intervene in the situation. Here now is Catherine Omantha with that report.
2 weeks ago, KTN highlighted a story about a community in Poro, Samburu West, that had taken matters into their own hands and built a shed only meters from the Angata Nanyuki government dispensary. This government facility is quite small, made up of only 4 rooms that can barely accommodate medical equipment, let alone a maternity wing. Samburu County and other northern counties have the worst healthcare records in terms of personnel numbers and access. Devolution has made it so that each county government is in charge of healthcare within its jurisdiction to ensure that communities like that in Poro have access to quality and accessible healthcare. However, health workers are concerned that the newfound power could collapse the healthcare system rather than improve it.
Whereas the constitution provisions are favorable to all Kenyans, the interpretation and implementation have been exclusive and inaccurate, leading to conflicts with the health workers and disruption in healthcare services delivery.
There have been queries among health workers over the criteria of their distribution among the 47 counties.
Health workers in the public sector should be considered a national resource that should be equitably distributed among all the counties. 2. The responsibility of hiring, retaining, and deploying health workers ought to be moved from the central government to an independent statutory body.
There is a consensus between the 2 health worker unions that issues concerning health workers should be centralized and controlled by the national government to avoid discrepancies brought about by different county government priorities. As it stands, the central government has already relieved itself of the duty of paying health workers, leaving the responsibility to county governments.
We have become aware of some problems in terms of cash flow for payment of salaries during this meeting, and we are actually now requesting the government to do whatever it can, because these are the problems we have been talking about.
Health workers want this move to be reversed until a solution is found. However, on the President's verified Twitter handle soon after the meeting with health practitioners at State House, it seems that the devolution boat has officially sailed. The President maintains that the process is irreversible, but he is willing to listen to the concerns of health workers to avert possibly the worst health worker strike Kenya has ever faced.
It is going to have very big ramifications to this country and beyond, and so we really want to exhaust all channels that are available before we can actually go on strike.
The 2 unions say that if the government is not willing to negotiate a solution over the next 13 days, they will down their tools on the 10th of December. This would leave the health care of millions of Kenyans who cannot afford private health care hanging in the balance. Catherine Omantha, KTN.